Have you ever opened a medical bill and found a charge you weren't expecting? This is a common scenario for many, despite efforts to protect patients from surprise medical costs. Jessica Chen, a physician assistant from Massachusetts, experienced this firsthand. After a medical procedure at Lowell General Hospital Saints campus, she was quoted $359 as her portion of the bill. However, weeks later, she received an additional charge of $1,677.51. This unexpected financial burden left her reeling and highlights the ongoing challenges even after the introduction of the No Surprises Act. The No Surprises Act, which came into effect in 2022, was designed to protect patients from surprise bills when receiving out-of-network care at in-network facilities or during emergencies. It marked a significant step forward in consumer protection. However, for insured patients like Chen, navigating complex billing systems remains a challenge, as the law doesn't fully cover all scenarios. For many, these unexpected charges are more than just financial. They represent a breach of trust and stability. Imagine budgeting for a specific amount only to be hit with a bill several times larger without warning. It's not just about the money, it's about the emotional stress that follows. Jessica Robbins from Chicago faced a similar ordeal when she was billed $3,300 2 years after her breast MRI. The complex process of resolving such issues often leaves patients feeling powerless and overwhelmed. This isn't just about isolated incidents, it's a systemic issue affecting countless individuals across the country. Have you ever received a bill that seemed much higher than anticipated? Zach Cooper, an associate professor of economics at Yale University, notes that many billing problems are surprising but not technically classified as surprise bills. His research shows that before the Act's passage, over 25% of emergency room visits resulted in unexpected out-of-network charges. The Centers for Medicare and Medicaid Services continues to receive numerous complaints regarding surprise billing practices. While current legislation addresses specific scenarios, broader reform is needed to cover situations like those faced by Chen and Robbins. Michelle Rodio's experience with Cleveland Clinic further illustrates this gap. After a routine nasal swab resulted in a $2,700 bill, she questioned why such costs weren't disclosed up front. These stories prompt us to reflect: how can we better prepare ourselves for potential financial surprises in healthcare? What questions should we ask before undergoing procedures? The path forward requires not only legislative changes but also greater transparency from healthcare providers and insurers alike. In conclusion, while progress has been made with the No Surprises Act, the journey toward comprehensive protection continues. As you navigate your own healthcare journey, consider advocating for clearer communication and fairer billing practices. How might you take steps to ensure peace of mind when it comes to your health and finances?